What are CCI edits? I hear you mention CCI edits quite a bit. Can you give me a brief overview, explanation on what CCI edits are and how I can access them? So I have a nice answer for you for that one. I didn't realize I talked about CCI edits that much, but it is good to know. You do not, just so everyone knows and doesn't panic, you are not tested on the two board exams about CCI edits. It's just something that's good to know to be a well-rounded coder. So, first of all, it stands for National Correct Coding Initiative, or CCI for short. Technically, it should be NCCI, but everyone says CCI. And these are for your CPT and HCPCS codes for physician and outpatient hospital settings. And they're going to affect reimbursement, so they are important to understand. Not that all coders do billing, but coding obviously is done for reimbursement purposes, so we should understand this information. So why were these edits created? To prevent unbundling of services. So, for example, my famous example that I always use, an exploratory laparotomy, where otomy means an incision, laparo means abdomen. So they're cutting into the abdomen, maybe to look around and see what's wrong, to diagnose something, but they're not really fixing anything. They're not doing any surgery. So if you bill a 49000 with another procedure like an oophorectomy, removal of ovaries, that 49000 is bundled into the oophorectomy because you have to do a laparotomy to go take the ovaries out. So these edits would show you that those two codes together can't work. It hits an edit. They say, no, you can't do it. So that's the unbundling. The second bullet, prevent incorrect payments from being made due to inappropriate CPT and HCPCS code usage. Detect incorrect or inappropriate reporting of combinations of codes. And curtail improper coding practices that lead to increased payment. So it's a system of checks. We know about diagnosis to procedure code edits. So you can have a very expensive procedure, but if you don't have a good diagnosis to support it, they're going to deny it. So that's an edit. This is just a different type of edit. It's instead of CPT and ICD, it's these two CPT codes cannot go together. And these edits are performed on every possible pairing of CPT and HCPCS. Now remember, when we say HCPCS coding system, it includes CPT. CPT is level 1 of HCPCS. As coders, when we think of HCPCS, we think of the volume 2 book, but it actually is both. They were developed and continue to be enhanced using coding conventions defined in the AMA's CPT manual with national and local policies and edits. National societies help develop coding guidelines, analysis of standard medical and surgical practice, and review of current coding practice. So what does it look like? Basically, you're going to have, well, it started off with 2 tables of CPT and HCPCS codes. And the table would have a column 1 and a column 2. Column 1 is considered the correct code or the allowable code. And column 2 is considered the wrong code in relation to the one in column 1. And there, my example of oophorectomy in column 1 and laparotomy in column 2. They would pay for the oophorectomy, but they would kick out the laparotomy. Okay? And so that's what this is saying. If a claim hits an edit, Medicare will pay the column 1 code, but not the column 2 code. Now, there's 2 types of tables. One is the comprehensive/component edits, which is what that oophorectomy example is. And this contains pairs of codes that should not be billed together. And the other is called mutually exclusive procedures and has procedures that can't reasonably be done together. For example, oftentimes we'll have a procedure and it will say partial. and then indented underneath it, it will say complete or vice versa. So you would never bill those two codes at the same time. It was either partial or it was complete. Okay, so hopefully you can kind of get an idea of the two types. According to the CMS website, these two tables have now been combined into one. And let me take you there so you can see this long URL. And I just Googled CMS CCI edits, and help me to find the page I need. And this is kind of smallish. So it's Home, Medicare, National Correct Coding Edits, National Correct Coding Initiative Edits. So it gives you all the history, a lot of the things that I just said. So it's a very good read. They've got these downloads here. Okay, and this one is very, very good. How to use the National Correct Coding Initiative. This is from the what do they call it? The Medicare Learning Network. And it has screenshots, and it tells you exactly, what they are, why we need to use them, how to use them, how to locate them. So this is definitely a great primer to print off, read, and study. Now, another way, this is the way I do it, because honestly, on the CMS website, they have it. It's free. It used to be you had to pay for CCI edits, but it's kind of awkward to use. I like using encoders like Find a Code. And they've got, let's see, where is it here? It's under More. And findacode.com is an online encoder that I really like. I think because it's purple. That's my favorite color. But I'll show you a way to get this at a discount if you're interested. So we're going to click on the More link because it says NCCI Edits. And here it's got NCCI Edits Guides and Manuals. And this is really great. It's got all the information, at your fingertips in this one little utility, along with all of your ICD and CPT codes and all of that good stuff. Now, if you want to actually use it, down here in the lower right-hand corner, Scrubbing and Validation, NCCI Edit Validator, and you can do it for non-facility or facility. So if we did it for non-facility, this is what the screen looks like. And I was in here earlier to answer another question, and I just popped the two codes in, and it lets me know that no, they don't hit an NCI edit. One is not bundled into the other. So encoders make it very easy. All right, so that is CCI edits.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.